I came into this from the perspective of healthcare systems and their relationships to the communities that they serve, where their patient numbers come from, and looking really closely at what are the various strategies that they engaging in or can engage in to improve community environment there. What do their community health related investments look like? As a doctor, I was doing field work with Dignity Health in San Francisco. Into my journey, working closely with the Division of Community Health, they have some different, very interesting strategies there, which you do see many of in the Bay Area. But they had something in particular where they were working with stakeholders and partnering with these stakeholders from the community development. Following up with Pablo Bravo, now the VP of that division, he suggested I speak to David Erickson, who is the director of the Center of Community Division at San Francisco Federal Reserve. Journey led me to reading David's book, The Housing Policy Revolution, Network Neighborhoods. David suggested that I become more familiar with what community development corporations do and see community development financial institutions and what is the Community Reinvestment Act, and looking at how institutions from the development or finance sector view communities or concentrations of unmet needs in regards to directing their investments. And as I began to look at this new sector, which is new to me, I was just a student, I had a aha moment of these are social determinants of health. These various stakes in the sector are looking at education, employment, housing, physical infrastructure, sidewalks, parks, childcare, access to health and social services, and these exact same ends that we were looking at from whether it be public health or healthcare in regards to how we improve the conditions of our community. We have to figure out how to get these folks from different sectors to work together, and here we are, years later. Thanks to the hard work of many of the folks here today and others, having these conversations now in a way that they weren't happening years ago.